Good morning, Ecuador, United Kingdom, Nepal, and Kosovo. In today's news, Wuhan presents new cases of a mysterious virus that started infecting and killing thousands of people. For the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold and the number of affected countries has tripled, which means that we now face a pandemic of global reach. To give an example, on the same day, March 12, 2020, the COVID crisis made headlines in both Ecuador and Kosovo, two countries in different sides of the world but facing the same health crisis. At present, there are more than 118,000 cases in 114 countries and 4,291 people have lost their lives, while thousands more are fighting for their lives in crowded hospitals. In the days and weeks ahead, we expect to see the number of cases, number of deaths, and the number of affected countries climb even higher. This has generated confusion, anxiety, and fear in the global population. According to the WHO, mental health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or weakness. Based on the COVID-19 situation the world has been facing since last year, our group has decided to do research on the mental health of students during the pandemic. The data was gathered by conducting a survey on students from various countries and universities. Their contributions will help us to have a better perspective on how people have been impacted by the pandemic, which were their experiences, and how to better assist students for their well-being. Results. The results we collected vary from country to country and thus from student to student. However, the types of mental illnesses that students recognized the most in both Ecuador and Kosovo were anxiety disorders including panic, obsessive-compulsive disorder, depression, bipolar disorder, and other mood disorders. In contrast, the least known disorder in students was the post-traumatic stress disorder. As students ourselves, we perceive that the quarantine has affected us in our studies. Equally, students from both countries, Ecuador and Kosovo, believe that the level of study has been much lower from home in relation to face-to-face learning, and that the level of teaching from the professors was not as expected. Another important factor to take into account is the economic factor, since many had to leave their studies and start to find a way to survive during the quarantine, risking their health. As reflected in the graph, the majority of students in Ecuador and Kosovo did have to go through these problems. Personal behavior was an aspect that affected most of them. As a result, students in both regions became more anxious and nervous during the confinement time. For the students, it was difficult to adjust to a virtual mode of study. They spent more time at home, and this allowed them to be more aware of the news around the world. However, this time at home also generated different types of symptoms that altered their mental health. In percentages, students in both countries suffered more of confusion than any other sentiment. For example, 39% of Ecuadorian students felt general confusion, a feeling that 35% of students in Kosovo felt too. Social isolation had its impact as well. The percentage of students affected by social isolation in Ecuador was 25% and 18% in Kosovo. Thus, Ecuadorian students showed to be more affected by isolation than students in Kosovo. In addition, 49% of students in Ecuador and 53% in Kosovo stated that they lost interest in learning during their virtual study experience. This clearly reflects that the online study experience affected more students' interest in studying in Kosovo. Finally, 37% of students in Kosovo reflected that during the pandemic they were able to develop some personal aspects, while 29% of students in Ecuador developed a state of monotony and thus developed some more personal aspects. In conclusion, the pandemic has indeed affected the mental health of students aged 18 to 20, causing depression, irritability, monotony, and anxiety. Constant exposure to the media and daily news on the pandemic have caused an increase in stress among students. Furthermore, the quarantine and online learning caused the loss of interest in studying. However, it seems that the discovery of the vaccine has increased the students' hopes and has contributed to some peace of mind. In addition, to increase study levels and learning interest in students, we recommend the following. A. Providing adequate electronic equipment for attending online lessons and study. B. Using fun games occasionally or take short walks around one's home in order to keep ourselves safe from others and also healthy and relaxed. C. Do yoga, meditate, or both. These help maintain a healthy mindset and a relaxed brain and will further help you focus much easily when studying. D. Organize your time according to your daily tasks and prioritize. E. Spend time with your family and communicate with friends or relatives. Don't isolate yourself. F. Read a good book, watch a good movie or stand-up comedy, or whatever makes you laugh and relax. Concentrating on studying only 24/7 will strain your brain and you won't be able to learn. G. Eat healthy and keep yourself physically active. Here's a potential solution to help with students' mental health. If there was a new pandemic for students to maintain a healthy mental state, consistent with our findings, we believe a good solution would be to select very carefully the news and media we follow. This would help prevent confusion and a state of stress, depression, or anxiety. If you liked our project and how we introduce different audiovisual techniques, please vote for pod number 9. This is all that can be reported by pod number 9. Greetings from Ecuador and Kosovo. Thank you.